What's up, everybody? Dr. Ranen here. Today I'm back with my friend and patient David McCall. So David has a history of lumbar disc injury with right-sided nerve pain, but he comes in with a slightly different injury which may be affecting that initial one. A couple of weeks ago he fell off his motorbike, tore the hamstring. He's got a bit of a wound on the right leg. And since then, he's starting to develop some lower back pain, right-sided hip pain, he's feeling a little bit of weakness in the right leg. So we're going to assess him, we're going to see what's going on, and then we're going to do some treatment as always. All right, let's get you to stand for me, please.
Yep.
Let's check your lower back out first. You want to face this way?
Do you want to take the shirt off or not?
Yeah, let's get you to pop it off.
Oh, I won't be able to have the mic.
That's fine. Let's take that off there. Switch that off for a second. Okay. All right. Any discomfort here?
Yeah, this I don't like at all.
In the middle or on one side?
In the middle and to the right.
And to the right, okay. Any discomfort here?
Yeah.
Right side, eh?
Right side,
Any discomfort here?
yeah. No, this just feels like a stretch.
This feels like a stretch, okay. Here,
Stretch.
okay. Here,
Yeah, I don't really like
you don't like that, okay.
It's not as bad though, it's going back.
Let's get you to bend forward slowly for me. Any discomfort in the lower back or in the right hamstring?
I mean, I just feel a stretch.
In the lower back?
In the lower back.
Okay, nothing in the leg, eh?
No.
All right, let's get you to sit for me, please. Can you straighten your left leg for me? Toes towards you, chin down. Any pain in the lower back or stretching in the leg?
Just normal stretch.
Just normal. Right leg for me, please. Toes towards you. Oh, you feel that quite tight, eh?
Well, because my hamstring as well.
Your hamstring's
I
also
can't
tight.
straighten my hamstring.
Okay.
But I can get there.
Any sensitivity in the lower back on the right?
Not too bad, this one.
Not too bad. Okay,
Yeah.
relax for me.
This feels nice for me. Anything slouching feels
Slouching feels better.
Yeah.
Okay. Let's just check everything's working well here. Can you sit upright for me? Grab your fingers, pull apart, look up. Okay. Okay, you can relax. Can you feel this?
Yep.
Same both sides?
Yep.
Here?
Yep.
Here?
Yep.
Can you lift your toes up for me, please? Hold. Good. The side, hold. Good. Bend your toes down. Hold for me. Good. The side, hold for me. Hold, 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 hold. Good. Okay, let's get you on your back for me, please. So you can see there's a nice puncture wound here. What was this from? What did you...
The bike into my leg.
Oh. All right. All right, leave your leg loose. Any pain in the lower back or stretching in your leg?
Just normal stretch.
Just normal stretch. Okay. Leave your leg loose. Loose, loose, loose. Any pain in the lower back or stretching in the leg?
Just normal stretch.
So here you don't feel the tightness in the hamstring.
My hamstring just feels like normal tightness.
Okay.
But like
Not like when you were in the slump test, when you were slouching and you needed to straighten it, eh?
Same, it just feels like stretch.
Okay.
I don't feel pain.
Okay.
For me, it's more comfortable lying like this.
Lying like this, okay.
Yeah, where I'm like...
When you putting your lower back into extension,
Yeah.
okay. Okay, let's check out your hip. Any pain here?
No.
Any pain here? Any pain there? Leave it loose. There we go. Any pain when I do this?
No.
Okay. Any pain in the hip? Just tight adductors.
Stretch, yeah.
Okay. Any pain there?
No.
Any pain here? Here? Any pain? No. Okay.
It just feels like
This side?
good stretch here though.
Yeah.
I'm really like tender in this area here.
Have you been trying to treat yourself?
I've just been doing isometric stuff.
Yeah.
That's it. And,
For quad and hamstring?
for quad and hamstring and
Yeah.
just this whole area.
Yeah. Okay. Lift your leg for me. Straighten. Straighten. Hold for me. I'm going to push down. Resist. Good. Turn your foot out. Hold. I'm going to push down. Resist. Good. I'm going to pull out. Resist. Good. Relax. Okay. Hold for me. It's not, just as I was about to say, it's not bad.
Yeah.
Okay, I'm going to push down, resist for me. Okay, so your hip flexor is not bad, but your quad is not great. Yeah.
Because my quad is not good.
All right, I'm going to pull out, resist for me. Adductor is fine. Okay, let's get you to turn onto your side. Please just check your glutes out on the left side. Okay. Hold for me, roll your hip forward. I'm going to push down, resist. Good. Come back for me. Hold. I'm going to push down, resist. Good. All right, let's compare it to the opposite side, please. Bend for me. Straighten. I'm going to push down, resist. Okay. Try not to use the quad so much, okay? Focus your attention here under my hand. Go. Yeah, there we go. Hold. Oh, yeah. Okay. Let's get you face down for me, please. Okay, so the sciatic nerve and the hamstring are very closely related. The hamstring's origin is the ischial tuberosity, and the sciatic nerve is exiting the pelvis very close to this origin point. So any hamstring insertional injuries can be affected or can affect the sciatic nerve. As the sciatic nerve passes down the leg through the hamstring, any injury to the hamstring can also affect the sciatic nerve. Patients have been known to form adhesions, so scar tissue between the sciatic nerve and the hamstring itself, and that can produce a lot of nerve tension, a lot of pain. So what I'm trying to do is differentiate between David's potential hamstring injury and potential nerve compression. Right now it seems like there's more nerve compression rather than an issue with the hamstring, which is causing his weakness and pain, because there's more global weakness around the hip rather than isolated. Okay. Relax your hamstring for me. All right, we'll start with this side. I'm going to push down, resist for me. Good, relax. Let's test the glute out here. I'll lift your leg up, okay? Squeeze your left glute. I'm going to push down, resist. Good, relax. Okay. Hold for me. Good, relax. So you see here there's quite good hamstring activation, which we normally wouldn't see in a patient with a hamstring tear. Lift up for me, hold. I'm going to push down, resist, resist, resist. It's not bad, but it could be better. Okay. Let's just have a feel here. Now, you said you had some bruising over the hamstring. Was this mid-belly?
Mid-belly.
Mid-belly, okay.
Yeah. I'm not sure if it was
From the puncture wound?
The wound, yeah.
Yeah.
From the hamstring.
Yeah.
But I did have a lot of hamstring pain here, which is
Close into the insertion.
But it's now gone.
It's now gone. Okay.
Yeah.
Any discomfort?
No.
No, feels fine.
Yeah. It's a lot better.
Yeah. Here, any sensitivity?
No.
Here?
No, it's fine.
Okay. Let's have a look at the lower back. Any sensitivity there? Yeah.
Yeah, loads.
Here,
loads.
yeah.
Yeah. Also loads.
Here, okay. Let's mark that.
It's like an 8 out of 10 that.
The last two, eh?
Yeah.
Okay, so that's L5, S1.
Yeah, loads there.
Yeah.
And there as well.
Let's double check here. Any sensitivity in here?
Yeah, on the right side.
Yeah, here. Sensitive there?
A little bit, not. Yeah, more on the right side.
More on the right side. Okay. Alrighty. Okay, guys. So we've just completed our assessment. There's no sensitivity on palpation of the hamstring. So we're going to put a question mark there around hamstring injury. There's obviously a wound here, so maybe some of the ecchymosis or bruising was coming from the injury to the hamstring. But we will work the hamstring because of the sciatic nerves kind of relationship to it in terms of innervation. Also, David is having a tremendous amount of sensitivity here at L5S1, and this nerve root supplies the right glute and the hamstring. So we will address it. If there's any issues still with the hamstring, he's probably going to see either less or more of it after we work on the lower back, which is going to be our primary area of treatment today. All right. Okay, man, you ready to go?
Yeah.
Okay. So you will also see that we placed a little towel under David's hips. He's having a tremendous amount of difficulty in lying with his lower back in extension. Now, when patients experience this discomfort, it's because of compressive force generally on the disc. So we know that he potentially has flared up that old disc injury that he has. You want to come back for me, please, David?
Yeah.
Little more.
What is it, back pain or lumbar radiculopathy?
It's a good question. It's more lower back pain. This is more lower back pain than a lumbar radiculopathy because there's no kind of gross nerve pain in the leg, no numbness, no pins and needles or anything, right?
Yeah.
Yeah? Okay. What he's experiencing is, what I think you're experiencing when you try and straighten your your right hamstring when you're seated is a tremendous amount of nerve tension. We're going to test that. In fact, that'll be a good assessment for us. We'll test that after treatment.
Okay.
So, David, you can't seem to shake the inherent athlete in you, eh?
The moment I stop is the moment I get old, so.
Ah, yes. Oh, no, that one's not necessary for today. Yeah. How old are you now?
38.
38.
Yeah.
How long has it been since you stopped playing rugby professionally?
10 years.
10 years, eh?
Maybe more. 12 years, I would say.
Yeah, that's what happens, man. Your body listens for the energy
Yeah.
that it comes with playing, well, in your case, professional sport, I guess.
Yeah.
All right. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. And relax.
I've been dreaming about this stretch.
Yeah?
Yeah.
Inhale. Exhale. Inhale. Exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. And relax. Okay, last one. Inhale and exhale. 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 And relax. Okay, so for those of you who are new to the channel, what we have just done is we've used a technique called Cox Flexion-Distraction. And the idea with this technique is to decompress the disc. And what we do is we run in a cycle form of stretching and relaxation. What this does is it creates a negative pressure in the disc, very similar to a vacuum, and that vacuum can facilitate disc resorption, where it can pull the disc back into place. In the absence of a disc injury, what it will encourage is resorption of nutrients, which help the disc to heal on its own. This will also help to offload the nerve root if there's any nerve root compression, which I suspect there is. And what I've done is I've combined that with the impulse adjuster. Now, the way I work is to layer therapy. Each therapy needs to add on to what I've done previously. So the impulse adjuster helps to fire up the muscles that are stabilizing the vertebra, and this will help to maintain the decompression process. Because when David stands, he's going to have gravity on the disc. If those muscles stabilizing the disc are not strong, then they're just going to basically shut down, and gravity is going to take over and stop the decompression process. You cool, man?
Yeah, cool.
All right, so we're going to get into some intramuscular electro stimulation.
Oh, this is going to hurt probably on this side.
So what I'm going to do is, because I know from previous experience of treating David that because of how thick his paraspinal muscles are, when we do intramuscular electrostim here, it is a bit sensitive. So first, I'm just going to work on the short duration stimulation, okay? And we get you to walk around, see how your back feels. If it feels better, then we won't go into the paraspinal stim, okay?
The worst spot is literally
There.
this is the worst.
Yeah.
spot.
You still feeling it now?
Yeah. All day when I'm at work, I'm just pressing that.
All day, eh?
All day I'm pressing this area, like I'm pressing it.
All righty. Let's go. You may feel a twitch here. Oh, there we go. So, some of you may know this area as the QL. For me, sensitivity over this muscle or under this muscle generally indicates irritation of what's called the superior cluneal nerve. And this nerve is commonly excited when you have irritation of the nerve root L4-5 and L5-S1. In fact, what I found is that the QL generally is short and tight because this nerve is irritated. You take away the nerve irritation, the QL settles down quite a lot. You good, David?
Yeah, good.
Not too bad?
It's like a good pain.
Yeah. You've been doing some vacuuming or bracing or anything?
No. Oh.
So you've also been on a cut, right?
I was, and then I came off it.
Yeah.
Yeah. I got down to like 94. Oh, that's sensitive.
Yep. So this area that we're working on here, you good?
Yeah, good.
You have your external oblique, you have your internal oblique, and then you have your transverse abdominis. And these three muscles are three major muscles in core stability. You have a nerve passing through here called the lateral branch of the iliohypogastric nerve, which supplies the transverse abdominis, internal and external oblique. And it's an assessment for me to determine whether the transverse abdominis is firing or not. If I push onto a patient's side and they feel it sensitive, it generally means that these muscles are going into a guarding reflex. Because this nerve is, again, overexcited or overstimulated. So I'm just doing a desensitization, but at the same time we're firing up these muscles because they will be inhibited due to the overall pain mechanism. You good? Oh. Got a bit of a twitch there. So now we're targeting the glute med muscle. This will provide some stability to the hip and pelvis and take some pressure off the lower back. And here we have the glute min. You good?
Mm-hmm.
Time for the big boy now, the glute max and the sciatic nerve. You good, brother?
Yeah.
Okay. Last one. You good?
Yeah.
All right. So we do a 5-minute stim,
Okay.
and then we just reassess your lower back and see if we need to do a long duration stim there. Okay. Okay guys, so you would have seen this technique being used. It's becoming pretty popular now. The difference between the way I do it and the way you may see it being done is I'm not just inserting needles into the muscle to target the muscle. I'm inserting the needles into strategic places. Can you feel that? Light, mild, or strong?
Mild. Yeah, that's enough, I would say.
It's enough.
Yeah.
Okay, I'll just drop down a little bit. Better now?
Yeah, that's fine.
Okay. So here we have the medial cluneal nerve. Here we have the inferior gluteal nerve. Here we have the sciatic nerve, and here we have the posterior femoral cutaneous nerve. Each of these nerves have a part to play in pain and muscle inhibition. I'm just going to move this here a little bit. How's it in the lower leg between here and here?
What do you mean?
In terms of intensity, I'm going to slow the other one down at the top
Okay.
so you can feel the leg a little bit more.
No, it was fine actually, yeah.
It's fine?
Yeah.
Okay, and too strong?
No,
or
that's okay.
Okay,
Yeah.
and the hip is fine.
I feel the lower leg more, but
You want me to reduce it?
no, it's fine.
Okay.
Yeah. What's the best like decompression stretch I can do by myself?
Reverse hyper.
Reverse hyper?
Yeah. But you've got to be careful.
Yeah, because sometimes one time I did this and I couldn't stand up again after like half an hour I couldn't stand up.
Yeah. You have to be careful not to overarch your back
Okay.
when coming up.
Oh, okay.
The way Louis Simmons does it is he does kind of do a swing in it.
Yeah.
But I think with you, who's kind of extension resistant,
Yeah.
you want to avoid that aggravation of extension in your lower back.
Yeah.
Essentially, what you want is when you come back up, you don't want your pelvis to rock too much.
Okay.
You want to kind of tighten your glutes and come into neutral.
Okay.
You know, in this journey of weight loss, I have to say I take my hat off to bodybuilders, man.
Yeah.
To get down to like, I don't know, whatever they get down to. I guess in one of Ronnie's videos, I think the Joe Rogan one, he said he was like at 1% body fat or something. I don't even know if that's possible.
Definitely not.
All right, let's get you to turn to your side and sit for me, please. We just reassess you before we continue with treatment.
this
Yeah, you're
side.
going to face the mirror, please. Okay. Let's just test the nerve tension before we go on. Can you straighten your right leg now, please? See how easy that is?
Much better.
Yeah. Okay, so that was definitely nerve tension. Let's get you to stand, please. You're going to face this way. Okay. How does that feel?
Still tender, but better.
Yeah. Here.
Yeah, better for sure.
Better for sure. Okay. All right. Let's get you on your back. Let's do some stim on your leg,
Okay.
and then we can. So we give your back a small break, and then I think while you're here, for what it's worth, we'll do a paraspinal stim. Let's get you to lift your head for me, please. There we go. All right. You need a towel for your back?
No. This position I'm fine.
You fine?
Yeah.
Okay. If you straighten your right leg,
Yeah, I'm okay.
it's okay?
Yeah.
Okay.
I just have to get my pelvis right.
Okay. Let's just pop this here. So guys, that's a nice little indication of how sometimes we can overlap hamstring pathologies and nerve tension. In fact, the first time I came across this was when I had my first lower back injury, and the physio at that time had told me it was this is the wrong side, man.
Yeah.
The physio at that time told me it was a hamstring strain, but turns out it was more of a nerve compression problem. And often the two can occur simultaneously. Two things can be correct. What we will do is we will again observe David over a couple of days, and I guess once you slowly start to return to training, you'll know how the hamstring is feeling, and then we can work more on that if need be. How's your Achilles?
Fine.
Fine, yeah?
Yeah.
Oops.
No issues with it so far.
Do you do any peptides?
Nothing.
No?
Zero. Nothing. Nothing.
You ever did peptides? No?
No.
You know, one thing I'm starting to notice is there's kind of a lot of patients that I'm seeing that are taking peptides seem to get through the initial injury, but ultimately return with pain in their joint.
Yeah, I don't think don't know. I'd rather just go straight for like the HGH.
What I think is happening is it's helping the injury, the scar tissue formation, the collagen synthesis, but it doesn't resolve the mechanical changes that occur during the injury.
Yes.
You know?
Yeah.
And lots of guys, I mean, you have a professional sport background, you know what it takes to recover from an injury.
Yes.
Lots of people don't have that background. Once they better, they return to sport without the rehab component.
Yeah.
I think that's the issue that I'm facing.
Yeah. I noticed that there's one isometric exercise that I started doing, which almost gives me like instant relief from this pinching sensation that I have, which is that like a 90-degree dead bug, like pressing onto my knee. So
yes.
This knee up.
Yes. No.
No. So
this is a psoas activation.
This, for me, is like I've found out is like really helping my.
That's very interesting because that's what I teach for psoas, as a psoas isometric, as a hip flexor, because what happens is the psoas is a primary hip flexor, but it's a secondary lower back stabilizer. And when you have lower back pain, it stops stabilizing the lower back. You know, it becomes inhibited and weak. So an isometric is going to fire it up and get it to provide your lower back with that stability. Interesting.
Yeah.
Okay, so we just did the an electrostim of the quad. Let's test this out. Hold for me, please. I'm going to push down resist. That's much better.
Yeah, much better.
All right.
Yeah.
Let's get you to turn onto your side. Let's check your glutes out, please. Straighten your bottom leg for me. Oh, sorry, bend your bottom leg, straighten your top leg. All right. Hold for me now. Remember, contract here, okay?
Okay.
Go. Much better.
Yeah.
Back for me. Hold. Much better.
Yeah.
Okay. Let's get you face down, please. Let me grab this from you.
I'm not sure if I have maybe some bone bruising or something in here.
In there, yeah. You okay?
Yeah, good.
Sensitive here, eh?
Yeah.
So if you guys want to check out another video of David's, you can scroll down in our channel and you'll find a nice interesting video of us treating an Achilles tendinopathy. And this was after the sevens, yes?
Yeah.
Yeah. It was not this year, last year, yes?
Year before that.
2024 or 2023?
3.
2023, there we go.
So what's the difference when you do up and down?
So
The difference?
I think it just depends on if the muscles are short and tight. So because he's having a lot of impaction here, I want to kind of separate the muscles and elongate them a little bit. You're really jacked up here in your mid-back, eh?
Yeah, I had a lot of, I didn't tell you that part, but I had a lot of trauma in my upper mid-back as well from when I fell.
Yeah.
Yeah, like really bad. But it's not bothering me as much as my lower back is.
Ooh. So it's very interesting that David mentions that he's getting relief with hip flexor isometrics and he's jammed up in his lower back. The psoas attaches to the transverse processes of, I think it's T12 to L2, and the nerve that's supplying your transverse abdominis comes out from T12. So any dysfunction in the mid-back is going to affect the psoas and the transverse abdominis. So we're probably going to do some manipulation in this region here today, I think. You can feel it's tighter here, eh? On the right side.
Yeah, I think the way I landed.
You landed on your back, flat on your back?
I landed on my upper back. Yeah.
Yeah, I can feel that there.
Did you see the video or not?
Yeah, I did. I even commented and I said, I guess I'll see you in clinic soon.
No, that was the other one.
Oh, that was another one.
That was the first one.
Oh.
You didn't see the other one, I guess not. Right.
It's okay when I do this?
Yeah. Yeah, I don't look at it break anything. But I honestly think that sometimes from playing rugby that I fall quite good. If that makes any sense.
You know how to fall.
Yeah.
Yeah. Oof.
Yeah.
You've got reflexes.
Yeah, bro. There was a study that was done at the University of Stellenbosch,
Yeah.
and it looked at, compared pro rugby players to amateur rugby players.
Yeah.
And what they did was they had a scrum half and a fly half,
Yeah.
and they got the scrum half to pass the ball to the fly half. What they found was that the fly half wasn't looking at where the ball was coming from. He was already looking at what his next move was going to be.
Yeah.
And that was the difference between the pro and the amateurs. The amateur fly halves were looking at the ball coming to them.
Yeah.
And David's a pro athlete, so reaction times and reflexes are going to be next level. I guess that's why you also did so well in boxing.
Yeah.
Did
I
you
think also with like gymnastics and stuff like that, you learn how to.
Oh, you've done gymnastics?
Yeah.
Okay. I'm surprised you didn't do wrestling or jiu-jitsu with your...
Yeah, I would like to do something like jiu-jitsu, I think, but again, it's just time, isn't it?
Time, yeah.
And also, I feel like jiu-jitsu. Let's say you dislocate a shoulder or do an ACL or something like that, you know. Some of these sports are better suited to being young, I think.
The problem...
Boxing, I don't need much mobility or.
Yeah. Yeah, that's also true.
But yeah, definitely I'd be suited to something like wrestling or jiu-jitsu for sure.
Can you feel that?
Yeah, it's good.
Light, mild, or strong?
Mild.
So it wasn't as bad inserting the needles today, right?
No.
Yeah, okay, good. I'm surprised your missus is still allowing you to ride after that, bro.
I mean, she's like, you know, but
Was the money, right?
yeah, bro. It just shows. It doesn't matter how big you are. You still get clean hit in the eye. It's
Yeah,
not
you
so
out,
nice.
bro.
Yeah.
Yeah.
But yeah, he's big.
Very interesting. I didn't know that, bro.
Yeah.
Bro, you are a man of many talents. I've seen some of the videos that you posted boxing. You knocked a few guys out, but I didn't know you sparred with Thor.
Yeah.
1 second.
Even who's the other pro guy? I forgot his name. He's a British champion. They asked me to spar them as well, but I didn't fancy it.
Okay, let's get you on your side for me first, and then on your to sit.
They pay for it though, you know. 500 dirhams a round, but
Yeah, sit for me,
it's
please.
dangerous. Oh,
Sit for me, please. You're
Okay,
gonna face
side.
this way, yeah. Okay. On your back, please. Perfect timing. On your back, please. No, you're gonna sit here and then lie on your back.
oh, sorry. Yeah.
Hello? Yeah, you can just ask him to come upstairs and take a seat. We won't be long. Thank you. Bye. On your back, please, brother. I'll adjust your upper back. Come down a bit for me. Well, how many rounds you did with him?
I don't know. I can't remember. Did a few times, 3 times, probably three rounds each time. Yeah.
You did better than Eddie did. Hug yourself, please. Lift your head up. No disrespect, Eddie Hall. I saw what you did to those midgets. Inhale, exhale. Oh. Straighten your legs for me, please. Inhale, exhale. There we go. Inhale, exhale. Drop your head back. Turn your head to the right, please. Inhale, exhale. Okay.
Try to do that side.
Yeah, that's what I'm going to do.
Okay.
Let's get you to turn. I want you to adjust your upper back first.
Okay, yeah.
You're going to turn onto your side, please. You're going to face this way. Yeah. Okay. All right. Bring your hips to the edge for me. Come. A little more. Okay. Straighten your bottom leg for me. There we go. All right. I'm going to pull you to the edge now, okay?
Okay.
There we go. Let's place that hand there. Look up for me, please. Inhale. Exhale all the way out. Inhale. Exhale all the way out. Oh, one more time. Inhale. Exhale. Oh, it's jammed.
Jammed so hard,
Yeah.
this one always.
Let's get you on this side. Face this way for me, please. Come to the edge for me. Straighten your legs. Let's pull you to the edge. Okay. Let's try one more time from this side. Give me your bottom hand. Let me pull you through. Okay. Swap hands for me. Roll for me. Inhale. Exhale. There we go.
We got it even before it.
Yeah. I actually adjusted that joint
Okay.
from this side.
Okay.
Sometimes it works like that. Let's get you to sit for me, please. Swing your legs over. Let's get you to walk around for me. See how you feel. Good?
Yeah.
All right, let's assess you. Let's get you to face this way. Any pain here?
Yeah, it's better.
Better, yeah. Here,
Better. Still a bit.
still a bit okay. Here,
Yeah, better.
all right. Okay. Let's. You can take a seat for me. Okay, guys, that brings an end to our video today. That was a great example of a patient with kind of a hamstring and nerve compression or sciatic symptom, and how we can differentiate the two and address both of them. If you guys want to do any personal training, if you want to get ready for summer, if you want to do weight training, boxing, please look out for David. Do you want to share where people can find you?
You can find me on Instagram easily, train with DMAC. That's it.
There we go. All right, you also have a meal prep company.
Yes, I do.
Yes, you want to share?
Yes. Yeah, I also have a meal prep company called Clean Cut, which you'll also see on Instagram. So for all your nutritional needs, I've got that covered as well.
Great. Okay, guys, thank you very much. Please like, subscribe, and drop any questions you may have in the comment section below. We'll see you soon.